Parents in KwaZulu-Natal are being urged to monitor their children for symptoms related to hand, foot and mouth disease. The disease is a contagious viral infection that causes flu-like symptoms, mouth sores and blisters on the hands and feet. Infected children can also suffer from fever and sore throats and show signs of irritability and loss of appetite. An expert in the health department says the virus is spread by direct contact with saliva or mucus.
Currently, we're sitting, as of last night, we're sitting at 117 cases, and we have more than 10 schools. Those schools would include your primary schools and the early childhood development centers. But what has been like what we have seen in most of the children are the blisters, which is one of the symptoms. The blisters would appear inside of the mouth. They will appear in the palms and the soles of the feet. And so that would make the child, struggle to walk and struggle to handle anything. We advise that you go to the health facility or the private doctor that is closer to you to seek medical help.
The health department says officials have started testing for the disease at affected educational facilities. Mhlongo says the virus is not uncommon, but that they are concerned about the outbreak.
Teams are out there, even the school health teams, they are visiting some of these early childhood development centers just to screen for those that are symptomatic. And I think already there was quite a number that they've visited, and then those children that were showing symptoms, then they refer them to the nearest health facilities. In terms of this virus, normally you would have it at this time of the year during the summer and autumn months of the year. And we have seen these cases before, but they were sporadic, so they were there was no cluster. I think what is different in this time around is that we have quite a number of clusters in different early childhood and primary schools. Hence now it's a concern, but just we have seen this disease before, but very sporadic, not an outbreak.
Mhlongo says the public shouldn't be alarmed as the disease isn't linked to the foot and mouth disease transmitted by livestock.
It's not the same as the foot and mouth that normally affects animals. It's not a zoonotic condition, the one that we have, meaning that it cannot be transferred from the animals or transmitted from the animals to the human being. So if you have like cows, don't be worried and try and isolate those cows because they will transmit the disease. It's totally different disease.
The department has urged parents to be cautious and to seek medical attention if their children present any of the symptoms between 3 to 5 days of infection. She also warned parents to refrain from self-medicating blisters at home, as these are said to be relatively painful. For SABC News, I am Jade Paulser in Durban.